Hello, everyone. Welcome to another episode of the Genuine Podcast. With us today, we have a great diabetologist, a renowned diabetologist from Jaipur, Dr. Rakesh Parikh sir, who is currently holding the position of Secretary General of RSSDI India. Welcome to the Genuine Podcast, sir.
Thank you, Nina.
So, sir, you are an expert in diabetes as well as artificial intelligence. So, let us talk about artificial intelligence in diabetes today. What do you think is the role of AI in diabetes practice today?
Yeah. So, first of all, I am not an expert in AI. Nobody can be, because AI is a field which is growing every day, and every day new and new things are coming up about AI. AI is picking up in every field of our life, and similarly, it's affecting the doctor's practice also. Particularly, you asked about diabetes. So, in diabetes, there are several applications of AI. Some of those we have been using since long time, and there are some upcoming applications also. So one of the applications which most of us have used for last many years is the AI enabled fundus cameras, which we use for diagnosing retinopathy. And the AI algorithms can basically grade the retinopathy, whether it's referable or not referable, whether it's NPDR or PDR, and it can make a diagnosis which is very close to the diagnosis made by a ophthalmologist. And by doing so, the AI has made our life very easy, because now we don't need to refer every patient for screening for retinopathy. We can just have a AI enabled fundus camera in the diabetes clinic itself, and the algorithm will tell us the diagnosis whether you require a referral or not. So that was the application that we have been using. There are several other applications, like one of those is AI enabled multispectral scan for diagnosing diabetic foot. So diabetic foot we can diagnose by seeing itself, but whether the infection is gram positive or gram negative, that also the camera can tell you by using algorithm. And that's a new thing. So you don't need to go for an empirical treatment. The diagnosis that the camera makes is 95% close to the culture diagnosis that you get after 3-4 days. So that way it is helping us. Then there are several other applications for prediction of diabetes, for prediction of complications of diabetes. So these are the different fields in which AI is now picking up, and there are several publications. So there are publications which even tell you that people have tried very different things by looking at the facial expressions of a person, by looking at the tongue texture of a person. The algorithm can tell to the tune of 80-90% whether the person is diabetic or not. And there are several other things like this. So AI has got a lot of potential, and you will see that every year newer and newer articles will come up talking about newer and newer applications of AI.
So, regarding publications, you have done so many publications, you have researched a lot in the field of diabetes as well as AI. What do you feel what AI will do to the upcoming research? How can it help uh, our D Genius members who are very young, who are
Yeah.
still doing their research, they are learning how to research? How can AI help us research better and research in a far greater way?
Yeah. So, research and publications is a very tedious task. It used to take months and years sometimes just to publish or write a paper also. Now, with the use of AI, you can cut short that time. It cannot replace your hard work of doing the research or writing a paper, but it is very helpful for various tasks. Like, for example, if you are a student or a youngster who wants to do research but is not sure what area should I focus on, so there are AI tools specialized to tell you that these are the areas where research is already there. These are the gaps in the research. So these are the areas where you can focus your research on. It can help you in fine tuning your hypothesis. Suppose you just want to say that I want to do diabetes in young, and I want to do research on that. Now, what in diabetes in young? So by using a AI tool, a simple tool like a ChatGPT also, you can fine tune your question about the area on which you want to work, for setting up the right hypothesis, then for making a protocol. So AI tools can write down the lengthy protocol which will take days otherwise in a short period of time. You just need to give the right prompt, what you want or what kind of research you want to do. So it will put up the standard fields already and give you a ready-made protocol for doing the research. Once you have done the research and collected the data, again the data analysis is a very tedious process. There AI also has a role. So in analyzing the data, AI is useful. For making the infographics or the statistics from that data, it is again useful. For writing your paper, again you can take the help of AI. Do not write the whole paper by using only a AI tool. There are tools which can give you a whole paper written immediately just by a prompt. But then I would advise that don't go for a ready-made tool like that for writing the exact paper, but to use it for different parts of your paper. You can use it for correcting the language of your paper, for critically reviewing your paper, suggesting you something, or for doing a literature review. Like doing a review of literature is again a lengthy process. So there are tools like elicit.org where you can go and you can find multiple articles which are already published. It will do the review literature for you, and then you can go through that literature review. So similarly, there are multiple tools, and I would suggest that we have already done multiple webinars. I think one of those was only through DGenius, where there was a whole series on writing papers,
Yes, sir.
and in that
Yes,
again we have spoken about AI tools in research also.
Yes.
Yeah.
Sir, AI is helping us treat our patient better. AI is helping us do research better. Do you think AI will replace us doctors in the coming future?
Yeah. So that is a question which many people are asking. See, as of now, we are using generative AI. There can be AGI in future, which is supposed to have the intelligence which is comparable to those of humans. But again, even after having that, which might come up in future, there are certain things which cannot be done by algorithm. So a job of doctor is not just to diagnose or treat, but to even be empathetic with the patient, do the patient counseling. These things can never be replaced by AI. So I would say that AI will not replace doctors, but all the doctors who want to be relevant in future, they must be aware of AI. They should start using the AI tools, and they should become familiar with the advancements in the field of AI so that you are not lagging behind.
Thank you so much, sir. It was a great learning experience from you. Thank you, everyone. Stay tuned for the next episode of the Genius Podcast.
Thank you, Nirmal.
Thank you.